Welcome to this online program on CPD record-keeping requirements. This program is designed to help you meet the CPD record-keeping requirements of the Pharmaceutical Society of Northern Ireland. We've all heard comments about CPD, and most tend to be negative. What are some of the comments you've heard or maybe said about CPD? They can be negative or positive. These are some comments that people have made. A waste of time, just box ticking. The markers are just trying to catch you out. How am I expected to find the time? They're just out to get you. We have made CPD too difficult for our profession. A lot of pharmacists comment on how long it takes to write up their CPD. On average, how long does it take you to write up one CPD cycle? Many of us spend far too long writing up our CPD. Anyone who is spending more than 45 minutes writing up each cycle will be glad they've undertaken this course. All pharmacists will have different opinions of CPD, probably based on past experiences. Some will have sailed through CPD assessment, others may have struggled and been frustrated, even annoyed or angry when the letter arrived saying that their CPD had not met the required standard. Regardless of your past experiences or opinion, this program is for you. So what is the aim of this program? The aim of this online program is to equip registrant and pre-registrant pharmacists with the knowledge required to meet their continuing professional development CPD record-keeping requirements. Bottom line is that we want to demystify the documentation of CPD and show that it is a straightforward process that is definitely not time-consuming and is definitely not too difficult for our profession. More specifically, the learning outcomes of this session are to provide you with a brief overview of the CPD, an overview of the CPD record-keeping requirements, an understanding of the CPD assessment criteria, guidance on how to record your CPD online. So what's the background to CPD? CPD has been a professional requirement for many years, and we've had to make an annual declaration on our PSNI registration retention forms, stating that we've undertaken 30 hours of CPD. New legislation was enacted and CPD became a statutory legal requirement from the 1st of June 2013. To coincide with the introduction of statutory CPD, a CPD framework was developed and published. All pharmacists who are registered with the Pharmaceutical Society of Northern Ireland must comply with the CPD standards and requirements outlined in the CPD framework. If you are a pharmacist registered with the Pharmaceutical Society of Northern Ireland and do not practice as a pharmacist, you are still required to complete and keep records of your CPD. You can access the CPD standards and framework document on the CPD section of the PSNI website, www.psni.org.uk. For the first time in June 2014, all registrants had to submit a CPD portfolio before the submission deadline on the 2nd of June 2014. Statutory CPD is not just for pharmacists, it is now a requirement for the majority of the other UK health regulators. So how much CPD do we need to do each year? We are required to do a minimum of 30 hours of CPD annually, and the CPD year runs from the 1st of June to the 31st of May. However, the PSNI allows 5 hours of this for documentation, and hopefully after this program, you will see that this is reasonably generous. So this means that we need to document a minimum of 25 hours of CPD each year between the 1st of June and the 31st of May. Before we consider how to record our CPD, we need to remind ourselves what CPD is. CPD is a process of identifying learning needs, addressing them, and applying the new knowledge or skills to change our practice. The purpose of CPD is to maintain public confidence in the pharmacy profession by continually improving our practice and improving patient care. In the regulations, CPD is defined as the continuing professional development which registered persons are required to undertake in order to have their name retained in the register and to maintain competence. the Council of the Pharmaceutical Society of Northern Ireland, Continuing Professional Development Regulations, Northern Ireland 2012. It is important to remember that CPD is different than continuing education. Continuing education is about acquiring raw knowledge. CPD is about using the knowledge to change our practice. CPD is an ongoing, structured, cyclical, 4-stage process of reflection, planning, action, and evaluation. Let's look briefly at each of these 4 stages now. Reflection is reflecting on your practice and thinking about what you currently do, what you'd like to be able to do, or what you'd like to do better, what you need to learn to help you make it happen. Please take a few moments to consider how you might identify a learning need. For example, perhaps there's a new service that you would like to be able to deliver. Example, would you like to deliver medicines use reviews and therefore need to know how the service is delivered and what paperwork is required? Often something can trigger a learning need. For example, talking to a colleague, a patient request for information, a course you're undertaking, or a new drug on the market. Remember, CPD does not have to be about something clinical. Many pharmacists have non-clinical, non-patient facing roles. Your learning needs could be around management of staff, research tools, or IT. For example, has the company you work for decided to install a new computer system or ordering system that you need to learn how to use? Reflecting on your current practice helps you to identify your learning needs. Planning is about considering what learning activities you could do to meet your learning needs. Please take a few moments to consider what types of learning activities you could do to meet your learning needs. For example, attending a workshop, reading, work shadowing, distance learning, a conference. Remember, attending a NICPLD workshop or reading Compass notes are only 2 types of learning activity. There are many others. It is important to set realistic objectives for your learning activities that are achievable. It might be ambitious to plan to read 45 volumes of the Journal of Thorax to learn about new treatments for COPD. It might also be unrealistic to plan to attend an advanced consultation skills workshop if your learning need is at a more basic level. Action is where you undertake the learning activity to address your learning needs. For example, undertaking the course, reading the journal, talking to a colleague, attending the study day, and learning what you need to learn. Evaluation is something you do after you've completed your learning. It helps you consider, have I met my learning needs? And how have I used the learning to change my practice? For example, successfully delivering the new MER service that you learnt about indicates that you have changed your practice as a result of the learning. The 4-stage process of reflection, planning, action, and evaluation we've just described is known as scheduled learning. Scheduled learning is planned learning, where we identify learning needs, address them, and apply the new knowledge or skills to change our practice. However, it is acknowledged that we can also learn when we haven't set out to learn, that we can use what we've learned to change our practice. This is known as unscheduled learning. Unscheduled learning is unplanned and unexpected learning where no prior learning needs have been identified. There is no reflection or planning. Therefore, unscheduled learning includes the action and evaluation stages only. For example, if I attend a monthly managers meeting to discuss company business, and this time the company had arranged for a communications expert to do a short session on communicating with staff during the meeting. If I learned the key points on how to communicate better with my staff and subsequently use this learning to change how I communicate with my staff, then this would be unscheduled learning. I attended the managers' meeting to discuss company business, but happened to learn about communicating with staff. I did not plan or set out to learn about communicating with staff. Now that we've reminded ourselves about the stages of CPD and the two types of learning, scheduled and unscheduled learning, we're going to spend some time considering how we need to record our CPD in order to meet the CPD standards and framework. It is important to recognise at the outset that recording CPD is not complicated and is not time-consuming. At the start of this programme, you considered how long it takes you to record your CPD. If you found it difficult in the past or have spent hours doing it, then hopefully things will change after completing this course. It is also important to note that CPD will look very different for someone who practices in community pharmacy compared to an academic or industrial pharmacist. Even within a particular sphere of practice, for example, hospital pharmacy, the diversity in pharmacy careers is huge, and hence individual practitioners in secondary care will have very different job roles, and consequently their learning needs and subsequent CPD will vary. The CPD system operated by the PSNI takes this into account. It can be used to document CPD for all pharmacists, irrespective of their unique working context. The recording requirements are exactly the same, regardless of the nature of your job. Let's look at scheduled learning first, and how to record your engagement in the 4 stages relating to this type of learning: reflection, planning, action, and evaluation. In reflection, we need to record what we need to learn and why we need to learn about it. At each stage of the CPD recording template, you will see leading statements and questions to prompt and help you meet the required standard. Remember to follow this and record what you were prompted to record. I specifically need to learn, then list specific learning needs. I need to learn about this because, and insert why you need to learn about it. It is important to document a clear statement of learning intent. For example, I need to learn, and to document specific learning needs. Remember to be clear and concise when documenting your specific learning needs. There should be no ambiguity. It is helpful to structure the specific learning needs as bullet points or a numbered list, instead of a long-winded paragraph. This means that each specific learning need can be clearly mapped through each stage of the cycle. Also, try not to include too many learning needs in each cycle to avoid the cycle becoming unmanageable and confusing. It is also important to contextualize the learning with a clear trigger or prompt for the learning. Why you need to learn about it. For example, the company I work for is introducing a new ordering system, and I need to be able to use the new system. Or, a new mum asked me about treatments for her baby's nappy rash, and I am unsure which treatments are available. Pharmacists can sometimes forget to be specific when recording their learning needs, so let's look at specific learning needs in more detail. If I recorded, I specifically need to learn about heart failure. Is this a specific learning need or non-specific? This isn't specific. Why is it not specific? Because I need to record what I need to learn about heart failure. It is a huge topic. Do I need to know about the causes, prevalence, drug treatment, prognosis, management? I should record, I specifically need to learn the causes of heart failure and the prevalence of heart failure in Northern Ireland. Let's look at an example of reflection. In this example, the pharmacist wants to learn about a new product, Femstral. I specifically need to learn the following about Femstral. 1. Indications and contraindications. 2. Dosage. 3. Side effects. 4. When to refer. I need to learn about this because Femstral is a new product launched which will be stocked in my pharmacy, and I need to know more about the product. The pharmacist has documented a clear statement of learning and has documented specific learning needs that are precise, succinct, measurable. There is no ambiguity. Bullet points and numbering have also been used. The pharmacist has also contextualized the learning with a clear trigger or prompt for the learning. In planning, it is important to record what activities you plan to do to meet the learning needs and when you plan to have completed them by. I plan to undertake the following activities to meet my learning need or needs. List the activities you plan to undertake. I plan to complete these activities by, and then insert a date. It is important to record full details of each learning activity. Full details means including sufficient detail that would allow an assessor to source each learning activity. For example, if you plan to attend a workshop, the CPD record should include the title of the workshop, the name of the workshop organizer provider, and the date of the workshop. It is not sufficient to simply record a workshop. If you plan to read a particular guideline, then include the title, number of the guideline, for example, NICE Clinical Guideline 38. It is not sufficient to simply record read a guideline. If you plan to access a website, then include the web address. Please note, if you plan to speak to a colleague or a GP as a learning activity, it is not necessary to include the name of the individual in CPD cycles to maintain confidentiality. Job titles are sufficient. In planning, also insert the date you plan to complete the activities by. Record a specific completion date, i.e., date, month, and year, not next month, within a month. Inserting a date by which you plan to have completed the learning activity or activities is a good motivational factor. You're more likely to complete by a certain date if you record a date. Let's look at how planning was recorded in our FemStral example. In this example, the pharmacist plans to undertake the following activities to meet their learning needs. 1. Complete the manufacturer's, insert name of manufacturer, community pharmacy training pack on FemStral. 2. Speak to the GP in high-field surgery with an interest in gynecology. The pharmacist plans to complete these activities by the 4th of the 12th, 15. You can see that the pharmacist has recorded full details of each learning activity that would allow another person to source each learning activity and the specific date they plan to have complete the activities by. In action, it is important to record what you did and a brief summary of what you learned about each of your learning needs. When recording action, there are 2 prompts leading statements to help us. Provide detail of the learning activities in the activity table. In summary, I learned the following in relation to my identified learning needs. Insert a brief summary. We're going to look at each of these now, starting with the activity table. In the activity table, we need to record full details of each learning activity that would allow an assessor to source the learning activities. For example, this means including the title, chapter, page numbers, and author of a book, the URL of a website, the title, author, and journal of a research paper. Remember, if the learning activity involves talking to a colleague, it is not necessary to include the colleague's name. Job titles are sufficient. We also need to record the start date, end date, time taken, and evidence for each activity. Don't be tempted to include unnecessary information in the activity table. Sometimes people record what they learnt or how they applied their learning. This is not necessary and just wastes time. The evidence should confirm that each learning activity has been undertaken. For example, personal notes from a discussion with a colleague, or an attendance certificate from a course or conference. Photocopying an article does not confirm that a learning activity has been undertaken. Sometimes people record NA, not applicable, or record application to practice, i.e. how the learning has been put into practice, but these are not evidence of undertaking the learning activity. It is important to retain the evidence for undertaking each activity. You may find it helpful to allocate a ring binder file for your CPD evidence to ensure that you retain the evidence methodically. in a format that can be easily retrieved. It is also helpful to cross-reference each learning entry in your file with your CPD records. It is currently not necessary to submit evidence with your CPD portfolio. However, the PSNI reserves the right to request it if necessary. Now let's look at the other important element of action, recording a brief summary of what you learnt. In addition to completing the activity table, it is important to record a brief summary of what you personally learned about each of your learning needs. The summary should contain examples of your personal learning. It is not sufficient to simply record the contents of the learning activity, for example, the objectives of a study day. For example, if your learning need was to learn what the side effects and contraindications of NSAIDs are, it is not sufficient to document in action, I learnt what the side effects and contraindications of NSAIDs are. This shows no personal learning. Rather, you should record, I learnt that the side effects of NSAIDs are, and list the side effects. I also learnt that NSAIDs are contraindicated in, and list the contraindications. It is important to relate what you learned to each of your learning needs. For example, if your learning need was to learn what the side effects and contraindications of NSAIDs are, but in action you document a brief summary about the use of PPIs with NSAIDs, then this bears no relation to your learning need and you have not addressed your learning needs. Similarly, if you record what you learnt about the side effects, but omitted to record what you learnt about contraindications, then you have not addressed all your learning needs. This is a stage where pharmacists can have difficulty, so let me reinforce the important points again. It is important to demonstrate personal learning in relation to each identified learning need. Now let's look at how action was recorded in our FEMS example, starting with the activity table. In the activity table for the FEMS example, we can see that the pharmacist has clearly recorded full details of each learning activity, together with the start date, end date, time taken, and evidence for each activity. They completed the manufacturer's insert name community pharmacy training pack of FEMS between the 17th of the 11th 15 and 20th of the 11th 15. It took 1 hour 45 minutes to complete, and they recorded evidence that can be retained and produced if necessary, a certificate of completion of online self-assessment questions. They discussed FEMS with a GP from Highfield Surgery with a special interest in gynecology on the 22nd of the 11th 15. It took 30 minutes to complete, and they recorded evidence that can be retained and produced if necessary. Personal notes from the discussion. Now let's look at what the pharmacist recorded about what they learnt. In summary, the pharmacist has learnt the following in relation to the identified learning needs. 1. FEMS contains 500 mg tranexamic acid and is indicated for heavy menstrual bleeding over several cycles in women with regular 21 to 35 day cycles. It is contraindicated in, for example, renal insufficiency, thromboembolic disease, on anticoagulants, irregular menstrual bleeding. 2. Dosage is 1 gram TID for a maximum of 4 days, increased to a maximum of 8 tablets in 24 hours if bleeding heavy. 3. Side effects are GI, discomfort, nausea, vomiting, allergic skin reactions, visual disturbances. 4. Refer if bleeding not reduced after 3 cycles, over 45 years, obesity, diabetes, polycystic ovary syndrome, or endometrial cancer. In this FEMS example, the pharmacist has clearly recorded a brief summary of what they personally learned about each of the learning needs. To help structure the recording in action, the pharmacist has numbered the brief summary of what they have learned about each learning need to the numbering of each learning need in reflection. The summary relates to their learning needs and contains examples of their personal learning. Now let's look at the final stage of the cycle, evaluation. In evaluation, we need to record whether or not our learning needs have been fully met, together with an example of how we've applied the learning or how we will apply the learning. In addition, we need to document a clear statement to confirm that all learning needs have been addressed. The prompt questions leading statements are: have I fully met my learning needs? Record an explicit yes, no, or have not. If you've only partially met your learning needs, perhaps a workshop did not cover one of your specific learning needs, then record that your learning needs were only partially met and then start a new CPD cycle with the outstanding learning need documented in reflection. I have applied or I will apply my learning in the following scenario. Provide an example. It is important to record a clear example of how you have implemented your learning and demonstrate how your practice has changed as a result of the learning. Therefore, you should reserve recording your evaluation until you've had the opportunity to put your learning into practice. However, it is acknowledged that there may be certain circumstances where it is not possible to implement the learning. For example, if you're currently unemployed or if a new service has not yet been launched. Therefore, the CPD framework permits simulated roleplay and/or future application of learning. Previously, a maximum of 20% of your annual CPD was permitted to be evaluated via simulated roleplay and/or future application of learning. However, this has changed. There is now unrestricted use of simulated roleplay and/or future application of learning should a registrant be unable to describe an actual application of learning. In these circumstances, it is still important to record an example of the simulated roleplay or how you will apply the learning. For example, simulated roleplay. A patient has not yet presented a prescription for the new inhaler device in my pharmacy. I use the placebo advice to demonstrate inhaler technique to a work colleague and explain the importance of loading and piercing the capsule before inhaling. When I observed my colleague using the placebo after the demo, she had difficulty holding the device correctly. So I demonstrated it again, and this time she showed good technique. When a patient brings in a prescription for the new inhaler device, I will demonstrate the necessary steps for appropriate inhaler technique using this device. Future application of learning. The new ordering system has not yet been launched in my department. When the system is launched, I will review the order list each morning by following the necessary 4 stages in the user guide. Validate the order and amend any inaccuracies before sending each order. I will log faults on the company website and will prepare a record of implementation issues for head office. It is evident from this cycle that my original learning needs have been addressed within this cycle tick box. In evaluation, it is also important to make sure that it is evident from the cycle that all your original learning needs have been addressed. Remember to review all 4 stages of the CPD cycle: reflection, planning, action, and evaluation, to ensure that each learning need is clearly mapped through all stages of the cycle with a clear application of learning relating to the identified learning needs, recorded in the evaluation stage. This is why bullet points and/or numbering are good. Tick the box when you've confirmed that it is evident that all the original learning needs have been addressed within the cycle. Please note, one application of learning may be enough to address all of the original learning needs. For example, counselling a patient on all aspects of a new drug treatment. Now let's look at how evaluation has been recorded in our FEMSTRAL example. In this example, the pharmacist has explicitly recorded that they have fully met their learning needs. Remember, if you have only partially met your learning needs, then record that your learning needs were only partially met and then start a new CPD cycle with the outstanding learning needs documented in reflection. The pharmacist has also recorded a clear example of how they implemented the learning and demonstrated how their practice has changed as a result of the learning. In this example, the pharmacist has reserved evaluating until they've had the opportunity to put their learning into practice. Reviewing all 4 stages of the CPD cycle, reflection, planning, action, and evaluation, it is evident from this cycle that the original learning needs have been addressed. Each learning need has been clearly mapped through all stages of the cycle with a clear application of learning relating to the identified learning needs, recorded in the evaluation stage. It is evident from this record that all the original learning needs have been addressed, and the pharmacist has ticked the box confirming that all the original learning needs have been addressed in this cycle. We've considered how to record the 4 stages of scheduled learning. Now let's look at how to record unscheduled learning. Let's remind ourselves what unscheduled learning is. Remember, unscheduled learning is unplanned and/or unexpected learning where no prior learning needs have been identified. There is no reflection or planning. Therefore, recording unscheduled learning includes the action and evaluation stages only. Let's look at how to record unscheduled learning, starting with the action stage. In the action stage, it is important to record what you did, i.e. the unscheduled learning activity, and a brief summary of what you learned, according to the following criteria. Provide detail of the learning activities in the activity table. Remember to include full details of the learning activities that would allow an assessor to source the learning activity and to include evidence for the activity. In summary, I learnt the following. Insert a brief summary of what was learned. Remember that it is important to record a brief summary of what you personally learned, and the summary should contain examples of your personal learning. So let's look at an example of unscheduled learning cycle, starting with the activity table. In the activity table for this example, we can see that the pharmacist attended a monthly managers meeting on the 12th of the 12th 15, which included a session on communicating with staff, delivered by a communications expert from First Rate Communications. The pharmacist has clearly recorded full details of the learning activity, together with the start date, end date, time taken, and evidence for the activity. The evidence recorded, a handout which includes personal notes, can be retained and produced if necessary. Now let's look at what the pharmacist recorded about what they learnt from the unscheduled learning activity. While the pharmacist was attending the monthly managers meeting to discuss company business, the company had arranged for a communication expert to do a session on communicating with staff. In summary, the pharmacist learnt the following. Be transparent about the business to create an open culture. Schedule informal meetings. Put dates in the diary to assess progress and identify problems. Always prepare for meetings, what you will say and how you will say it. Be aware of your own weakness. Play to your strengths and work on your weaknesses. Be honest. Sharpen your message. Keep to 3 to 5 key points in any communication, especially email. Recognize good work. Balance constructive criticism with compliments. Recognize non-verbal communication, example body language. Don't slouch or appear disinterested when talking with staff. In this example, the pharmacist has clearly recorded a brief summary of what they personally learned. The summary demonstrates a depth of learning and contains detailed examples of their personal learning. Now let's move on to evaluation. In evaluation, we need to record an example of how we have applied or will apply the learning from the unscheduled learning activity. The prompt or leading statement is, I have applied or I will apply my learning in the following scenario. Provide an example. Remember, it is important to record a clear example of how you have implemented your learning and demonstrate how your practice has changed as a result of the unscheduled learning. Therefore, you should reserve recording your evaluation until you've had the opportunity to put your learning into practice. However, as previously mentioned, it is acknowledged that there may be certain circumstances where it is not possible to implement the learning, for example, if you're currently unemployed or if a new service has not yet been launched. Therefore, the CPD framework permits simulated role-play and our future application of learning. There is now unrestricted use of simulated role-play and or future application of learning, should a registrant be unable to describe an actual application of learning. In these circumstances, it is still important to record an example of the simulated role-play or how you will apply the learning. Now let's look at how evaluation has been recorded in our manager's meeting example. In this example, the pharmacist has evaluated as follows. I have scheduled brief, informal 10-minute meetings with each individual member of my staff on a weekly basis and full staff meetings monthly. At a recent meeting, one particular staff member indicated that she had been thinking for some time about learning sign language to help communicate with deaf patients who use our pharmacy. I encouraged her to go for it and arranged for our head office to fund a sign language course. The staff member was delighted and has now registered for the course. I know the pharmacy will benefit immensely from these skills. The pharmacist has recorded a clear example of how they implemented the learning and demonstrated how their practice has changed as a result of the learning. In this example, the pharmacist has reserved evaluation until they have had the opportunity to put their learning into practice. Now, having addressed how to record CPD, let's consider how CPD is assessed. CPD is assessed by a team of experienced assessors. CPD is assessed in an open and transparent manner, and the assessment criteria are available to all registrants and are published on the CPD section of the PSNI website. This means that you can assess your own cycles prior to submitting to ensure that each cycle meets the required standard. This is something we strongly encourage you to do. Scheduled learning is assessed using 9 criteria, and unscheduled learning is assessed using 2 criteria. The 9 criteria are based on the prompt questions, leading statements included at each stage of the CPD cycle template. Best practice guidance and not acceptable practice guidance for assessment have been prepared for each criterion, and this guidance is also available on the PSNI website. Let's take a look at the 9 criteria and the guidance now. This slide and the next few slides have been included to show images of what the assessor guide looks like. This assessment guide can be accessed by the PSNI website. Criteria 1. Did the pharmacist identify specific learning needs? Best practice, clear statement of learning intent, followed by bulleted specific learning needs. Specific, precise, succinct, measurable, no ambiguity. Not acceptable practice, review, update, revisit without any specific learning need identified. Feedback will be provided regarding best practice. Criteria 2. Did the pharmacist describe why they wanted to learn about this? Contextualize learning with a clear trigger prompt for the learning need. Not acceptable practice. I feel I need to know more about without further explanation. Feedback provided regarding best practice. Criteria 3. Did the pharmacist describe the activities they plan to undertake to meet these needs? Best practice. Full details relating to the learning activity that would allow an assessor to source that specific learning activity. Please note that specific names of colleagues are not required. Job titles are sufficient to demonstrate the expertise of the tutor. Not acceptable practice. Less detailed information, for example, a workshop, article, courses, internet search, but no further detail is present in the cycle. Feedback being provided regarding the best practice. Criteria 4. Did the pharmacist indicate when they plan to complete the activities by? Best practice, specific completion date. Not acceptable practice, learning activity not time limited. Feedback provided regarding best practice. Criteria 5. Did the pharmacist provide a description of the learning activity they completed to meet the learning need? Best practice, full details relating to each learning activity that would allow an assessor to source the learning activity, plus completion date, time and evidence. Please note that specific names of colleagues are not required. Job titles are sufficient to demonstrate the expertise of the tutor. Not acceptable practice, no learning activity identified, only recorded application to practice. Not applicable, NA recorded in the evidence section of the activity table. Date, time, evidence sections of the activity table not completed. Very generic phrases, the internet, a workshop, etc. Feedback provided regarding best practice. Criteria 6. Did the pharmacist include a brief summary of what they learnt? Best practice. Brief summary with examples of personal learning in relation to each learning need. Summary relates to learning needs. Summary contains specific detailed examples, multiple of personal learning. Not acceptable practice, no personal learning demonstrated. Summary of contents of learning activity. Feedback provided regarding best practice. Criteria 7. Did the pharmacist indicate whether or not they had met their learning needs? Not acceptable practice, implied response, not stated, for example, I have a better understanding. Feedback provided regarding best practice. Criteria 8. Has the pharmacist indicated how their practice has changed, will change as a result of their learning, or how they have applied, will apply their learning to practice? Best practice, clear example of implementing learning, changing practice. Demonstration of transition as a result of learning activity. Now I can. Specific example of how the learning has been applied or will be applied to future practice. Not acceptable practice. I feel that I can now, with no justification as to why the individual feels that way. Generic statement relating to use in practice. Future practice, for example, I use, will use this in my practice, future practice. Feedback provided regarding best practice. Criteria 9. Is it evident from the cycle that the original learning needs have been addressed? Best practice, each learning need is clearly mapped through reflection, planning, action, and evaluation stages of the cycle. Not acceptable practice, no mapping of learning needs through all stages of the cycle. Feedback provided regarding best practice. It is important to note that 5 of the 9 scheduled learning criteria are essential. Therefore, not meeting any one of the 5 essential criteria will mean that the CPD cycle will not meet standard. These are criteria 1, 3, 6, 8 and 9. 1. Did the pharmacist identify specific learning needs? 3. Did the pharmacist describe the activities that they plan to undertake to meet these needs? 6. Did the pharmacist include a brief summary of what they learnt? 8. Has the pharmacist indicated how their practice has changed, will change as a result of their learning, or how they've applied, will apply their learning to practice? 9. Is it evident from the cycle that the original learning needs have been addressed? In unscheduled learning, 2 criteria are essential. Therefore, not meeting any one of the 2 essential criteria will mean that the unscheduled CPD cycle will not meet standard. The 2 criteria are criteria 6 and 8. 6. Did the pharmacist include a brief summary of what they learnt? 8. Has the pharmacist indicated how their practice has changed, will change as a result of their learning, or how they've applied, will apply their learning to practice? Now, let's look at the assessment outcome. When all of the CPD cycles within the portfolio have been assessed, then the assessment outcome is determined. For the CPD portfolio to meet standard, 40% or more of the CPD cycles in the portfolio must have met standard, i.e. meet all the essential criteria. If less than 40% of the cycles in the portfolio have met standard, then the CPD portfolio does not meet standard. If the CPD portfolio does not meet standard, then the pharmacist enters a reassessment process where the pharmacist must submit 3 new cycles within 2 months. 2 reassessment opportunities are provided. During this period, from notification of result to submission deadline, facilitation help and support will be provided by the Pharmacy Forum. This programme focuses on the recording of CPD. However, if you would like more information on the reassessment process, then you can contact the PSNI post-registration lead, Michelle McCory. However, in a nutshell, if you have 10 CPD cycles in your portfolio and only 4 meet standard during assessment, then the CPD portfolio will still have met standard. A feedback report will be provided online for portfolio records that have been assessed by a CPD assessor. Feedback is more detailed for portfolio records that have not met the standard and less detailed for portfolio records that have met the standard. Feedback is informative and focuses on the parts of the CPD cycle where improvements can be made. Now we're going to spend a short time finding out how to record CPD online. There are 2 options for recording your CPD. The preferred method is online via the PSNI website www.psni.org.uk. Alternatively, pharmacists can choose to make paper-based records. Online recording has a number of advantages over paper-based records. It is easy to edit, confidential, secure, user-friendly. So let's take a walk through recording CPD online. You are not expected to read the text in this slide or the next number of slides. The intention is to demonstrate a brief walk through the online recording. First, select CPD on the PSNI website homepage on the grey section at the top right-hand side of the page, not the CPD option on the main purple banner. It contains information about CPD, but you cannot record CPD there. This opens the membership online page. You need to create a membership online account to access the membership online section of the website. You only need to do this once. To do this, select Get Started. Insert your PSNI registration number, surname, date of birth, and email address. Then select Next for PSNI to verify your identity. When PSNI has verified your identity, you will receive an email from PSNI, usually within a few minutes, which includes a verification link so you can continue to create your new account to register for membership online. When you've completed the registration process, then you can log in. Log into the membership online using your email and password. This will open the main CPD page. This is the main CPD homepage where you can view your online CPD portfolios, create a new CPD cycle, and access helpful information about CPD, including the CPD manual, framework, and frequently asked questions. We are going to focus on how to record a CPD cycle online. To create a new CPD cycle, click on Create a New Learning Cycle. Enter the cycle name. Select the type of learning, i.e. scheduled or unscheduled. Confirm that the learning activity is relevant to the safe and effective practice of pharmacy and your scope of practice. Helpful information about CPD, including the CPD manual, framework, and frequently asked questions can be accessed on every page of the CPD recording process, from creating the new cycle right through the reflection, planning, action, and evaluation pages. The same banner is available on each page. Once you've completed these fields, then select Create Cycle. This is the planning stage. The prompt or leading statements given are, I plan to undertake the following activities to meet my learning needs. This is clearly marked as an essential criteria. And I plan to complete the activities by. This is the action stage. The prompt questions leading statements given are, provide detail of the learning activities in the activity table, and, in summary, I have learnt the following in relation to my identified learning needs. This criteria is clearly marked as an essential criteria. In part 1, record activities by clicking on Add a new activity. Insert details of each activity in the activity table, then complete part 2 of the action stage. In part 2 of the action stage, enter a summary of what you learned. Remember to save progress. This is the evaluation stage. The prompt questions leading statements given are: I have fully met my learning needs. I have applied or will apply my new learning in the following scenario. Or I have changed my practice in the following way. This is clearly marked as an essential criteria. It is evident that my original learning needs have been addressed within this cycle. Revisit the reflection stage and decide if you have met your learning needs and tick the box. This is an essential criteria. To delete a cycle, select Delete this cycle at any stage of the recording process. This completes the online recording of the new CPD cycle. Now let's look at what resources are available to support you in recording your CPD. The following resources are available and are listed in the CPD section of the main PSNI website. 1. CPD Framework and Standards 2014 includes information relating to CPD compliance, non-compliance, consequences of non-compliance, and restoration to practice, and is accessed via the CPD section of the PSNI website. CPD Assessment Guide provides detailed guidance on how to record CPD to meet the assessment criteria required by PSNI. This includes the assessment criteria together with the best practice and not acceptable practice guidance. This is accessed by the CPD section of the PSNI website. CPD Online Manual is an online resource covering all aspects of the CPD process and is accessed via the CPD section of the PSNI website. Northern Ireland Centre for Pharmacy Learning and Development, NICPLD, provides live and distance learning courses. A Pharmacy Forum provides facilitation support through a number of mechanisms, for example, facilitation sessions, brief one-to-one facilitation. The online resources available via the PSNI website are updated regularly to reflect feedback from registrants, the assessor team, and from Council. This ensures that the resources remain up-to-date, relevant, and are tailored to the needs of registrants to help maximise their compliance with the CPD requirements. Now we're going to briefly look at the key points from the CPD standards and the main changes to CPD. The key points to note from the CPD standards are: keep a legible record of your CPD, online preferred, complete a minimum of 30 hours CPD, 25 hours learning activity plus 5 hours documentation. A partial pro rata submission of 15 hours may be acceptable in some extenuating circumstances, and we will look at extenuating circumstances in a moment. Complete a minimum of 4 CPD cycles, record a predominance of scheduled learning cycles, comply with the recording format and assessment criteria that we have reviewed in this programme. Record if CPD is relevant to the safe and effective practice of pharmacy and to scope of practice. Submit CPD portfolio by the published deadline, 31st of May. Registrants have 60 days in which to make a CPD submission to the Pharmaceutical Society NI. The portal or window to the online facility allowing you to make a CPD submission will open on the 1st of April each year and close on the 31st of May each year, before midnight. This means that you can submit your online CPD portfolio record anytime during this 60-day period. For those submitting a paper-based portfolio, the same rules apply regarding your CPD submission. You need to submit 2 copies of your portfolio, one with your registration details and one which must be anonymised, before the submission deadline of 31st of May each year. The CPD standards and framework have brought a number of changes to the CPD process, and it is important that we are all clear about these changes. So what are the key points? The CPD framework highlights some key points to remember about the CPD process. The annual submission of a CPD portfolio from all registrants by 31st of May. Previously, only selected registrants were required to submit. The 5 essential criteria, 2 essential criteria for unscheduled learning, have been clearly indicated. The unrestricted use of simulation and/or future application of learning in the evaluation stage should a registrant be unable to describe an actual application of learning. An application process is available for extenuating circumstances, and we will briefly look at extenuating circumstances in a moment. That is, requests for CPD exemptions, deferrals, or partial submissions. If you would like more information on this, please contact the PSNI Post-Registration Lead, Michelle McQuarrie. 2 remediation opportunities for registrants who make unsuccessful submissions. The detail relating to extenuating circumstances is outside the remit of this session on CPD recording. However, it is important to know that an application process is available if extenuating circumstances do occur, so we will consider this briefly. The CPD framework refers to an extenuating circumstance or reasonable excuse as a circumstance beyond the individual's control, which has had a significant and/or detrimental impact on the individual's ability to comply with their CPD requirements. CPD should be recorded throughout the year. Therefore, it is only in cases where the ability to undertake CPD throughout the year has been significantly affected that an application for extenuating circumstances should be made. 2 options can be requested. 1. Exemption or deferral. If you have been unable to work because of, for example, a long-term illness, unemployment is not considered to be a valid reason. 2. Partial submission. If you have been on the register for less than 6 months or have worked less than 6 consecutive months in the CPD year, 15 hours is required for a partial submission, i.e. 12.5 hours CPD plus 2.5 hours documentation time. An application form should be submitted normally within 21 days of the untoward event arising and normally before the 30th of April deadline for applications. Each application is considered on its own merits and on a case-by-case basis. The application form can be downloaded from the PSNI website www.psni.org.uk. If you would like more information on extenuating circumstances, please contact the PSNI Post-Registration Lead, Michelle McQuarrie. Let's remind ourselves of some of the top tips to remember when recording our CPD. Read and answer the prompt questions leading statements. Identify specific learning needs in reflection. Bullet points, numbering are good to help structure recording. Relate each stage of the cycle to the specific learning needs identified in reflection. Be clear and concise, no ambiguity. Remember, if you consider a cycle to be ambiguous, it will be ambiguous to a CPD assessor. Don't waste time including unnecessary text. Just record what you need to record. Self-assess using the assessment criteria before submitting. This will make sure you've met each criterion before you submit. Remember to be objective. If you find it difficult to be objective, perhaps you might ask a friend or colleague to be objective. Spread the workload and don't leave it until the last minute. Remember to access the resources available by the PSNI and Pharmacy Forum. I hope you find this helpful and wish you every success as you continue to record your CPD.